Welcome to Skin Sense here at SSPTV and SSPTV.com. We have a brand new show. We're with Dr. Steve Schleicher, and we have my son Mason Mazurkiwecz with us today. How you doing?
Good.
This is his first TV appearance. He's our little guest today, right, Doc?
Yeah, this is awesome. So I told him he might make it big, and next time we see you, it'll be like Beverly Hills.
He'll be giving out autographs.
How cool would that be?
What do you think?
Yeah.
Yeah.
All right, so why is he on the show? We're talking about eczema. Affects a lot of people each and every year.
Absolutely. And they call eczema the itch that rashes. So basically, people are born with this condition. Sometimes it comes out later in life, sometimes it comes out sooner. So there's usually a hereditary. So anybody in your family that you know of has eczema? Or hay fever or asthma? Believe it or not, it goes along with hay fever and asthma also.
Does it go along with
Okay.
allergies? Because our family, my
Some
side has
yeah.
a lot of allergies,
Yeah, hay
food
fever,
allergies,
absolutely.
very sensitive to detergents
Absolutely.
and some food.
Yeah, yeah, they're all related.
Okay.
Okay, and they all have to do with the immune system and the way people tolerate the immune system. And, you know, interestingly, they've shown that kids with pets have a less chance of developing eczema because they're exposed to more germs that way.
Well, we're allergic to dogs and cats.
So
Yeah.
forget
Right?
that. You may have to get a salamander or something like really cool.
So we had, what
Tarantula.
pet did you have?
Lizard.
He had a lizard, and
Oh.
we have 2 betta fish.
Oh,
So that's
I don't know
where
if
we
they count.
They don't count.
I don't think they count. We'll have to check, all right? So, but yeah, people are really, really sensitive. So when did you start itching? Do you remember? Like,
When did you start itching?
not the exact date, but around.
How old were you?
I don't know.
Maybe 2?
2.
2 or 3?
Okay.
And where was the itching? What parts of your body?
Behind my knees,
Okay.
Okay.
and on my foot.
And on your
Okay.
feet. He
So
gets it around his ankles, behind
Okay.
his knees, on his arms, behind his ears.
Well, see, those are all classic areas, okay? People with eczema, the classic spots are behind the knees and behind the elbows and the neck, okay? And people can start itching on their face and anywhere else, but those are classic. And people tend to either grow in or grow out of eczema. Can be very bad as a kid, and then as you get older, hopefully for you, you'll be one of the kids who just grows out of it by the time you're a teenager. Unfortunately, well, I just saw 2 adults today who've had eczema all their lives, and they were very, very severe. So, but that's usually not the case.
All right.
So we're hoping.
Now, could some things aggravate your skin and then turn into eczema? We were away recently, and we're going to show you some pictures when we came back from the irritation of the chlorine and the water rubbing against the back of his legs. He was scratching, as you said,
Well,
about the itching and the spreading.
Exactly. Well, temperature changes definitely play a role. Okay, but it's usually cold. Okay, people who have eczema are more sensitive to the cold, and that can make it worse. But of course, you guys were down south, and then you came back, and it was cold. Certain clothing can make it worse. Anything with wool can make you itchier. Okay, so we tell people with eczema, get clothes without wool. Okay, and then some people are just very, very prone to things like perfumes and hairsprays. So even if you as parents are wearing that, if your child is sensitive, sure, they can develop symptoms just from that, and that's more allergic.
Soaps.
But that can happen.
You got to watch about soaps and shampoo and different kinds of suntan lotion for us. He's
all those
allergic
things,
to suntan
right.
lotion.
All those things, well, they have chemicals in them, and some people are very, very sensitive to chemicals, and so you have to be careful. So we tell people to use very, very mild soaps, okay? People shouldn't overly bathe. It's kind of a myth that you have to bathe every day, okay? But if you do bathe, you want to use a mild soap, and as soon as you get out of the bath or shower, make sure you totally dry off, okay? Because if you leave moisture on the skin, when you get out of the bath or shower, what's going to happen? The moisture is going to evaporate and pull water from underneath your skin.
Aha!
Okay, so
Now I see why we're
and-
developing the eczema
right, and
behind the
that-
legs
and
where we don't dry it
yeah,
off.
Yeah, and that's the best time to wear a moisturizer. So if you're going to use a moisturizer, then it's okay if you're a little bit damp, as long as you put a moisturizer, because that'll trap that moisture, okay, and will help your skin. Okay, now I saw Mason about a week and a half ago, and he was broken out, okay, and his eczema was flaring. and we gave him a medicine.
Yes,
and he
we
did,
had them with us.
Yeah, and he did great. Okay, so
You gave us this once before, so at home we use Verdeso.
right, and that's what's
And
called
mousse?
a low potency topical steroid. It's kind of like hydrocortisone that you can get in the drugstore, but it's a little bit more potent than that. And it's very, very safe, and you can use that all over.
And then we came in to see you, and you saw the pictures, and you gave us Cloderm, and this is a cream.
Right, and Cloderm is a more potent topical. They're called topical steroids, and they can be used to treat anything from eczema to things like poison ivy, okay, and they work very, very well. But the key is you want to use the strongest strength first, and then as people get better, we tend to decrease the strength. And then hopefully just moisturizers alone will control this.
Now, I
Okay.
know that you do have, or you did have some different kinds of sunscreen. If you do have eczema, which I was a bad mommy and forgot ours, so we bought sunscreen down there, right, that you can use. But this sunscreen is one that
Right.
he does well with.
Right, and sooner or later it'll get sunny around here, but hopefully. But some sunscreens have a lot of chemicals in them.
Okay.
But there are some sunscreens which have minerals such as zinc or titanium, which is the one you have there.
Okay.
And they're less prone to cause allergic reactions. So in people who are really, really sensitive, yes, any sunscreen with zinc or titanium, that's what I recommend for people with sensitive skin. So that's kind of important.
Can you get that sunscreen over the counter?
Yeah, all sunscreens are available over the counter, which is
Okay.
good. But you want to make sure, again, if you have sensitive skin, make sure it has zinc or titanium dioxide in there. Okay? Mason, you have anything to add? This is your big debut, all right?
Yeah.
Say something, all right?
What do you
I
think
mean,
about
like-
coming to see Dr. Schleicher? Did he help you with your eczema?
Yeah.
Okay, so
Oh, good.
before we came, it was all itchy, right? Describe that, what it felt like.
Itchy.
Okay.
That was perfect.
So eczema, a lot of people have it. It is treatable. Some
It's treatable,
pictures.
it's not curable.
Okay.
But the real good news for people with severe eczema is the fact that the FDA is about ready to approve an injectable medicine, which the preliminary results are phenomenal. Okay, so stay tuned because it's going to bring relief to a lot of people.
Okay, from eczema to one of my favorite topics, we're going to talk about Botox and fillers and, just
Yeah,
upkeep.
For once, we're not doing you today.
I know, for once.
All right,
so we have
so-
a guest with us and brought in one of my friends, and we're going to talk about doing this instead of getting a facelift. Talk about some procedures that you can get. That
I think,
are
Mason, you're a little too young for
non-surgical.
Botox.
Do you want
all right?
Botox?
So come back.
Needle in your face?
Come back
What do you
next year,
think?
all right?
What do you think? All right, so we'll be right back. You're watching Skin Sense here on SSP TV and SSPTV.com. And we're back here on Skin Sense on SSP TV and SSPTV.com. We talked about eczema, and now we're with Stephanie Almeida, and she is our next patient. And we're talking about Botox, which is very popular. Very popular.
I think last year there were 6 million Botox injections given. 6 million. So it is the most popular cosmetic procedure. So you're in good company.
Good.
Okay?
So welcome to the show, Steph.
Well, thank you.
So tell us a little bit about your background and what you do.
I own a salon in Drums, Pennsylvania, and I'm pretty much in the cosmetic field, so something like this is totally normal for me. I'm excited and trust doctor, and I'm ready to go.
Okay. Do you mind sharing how old you are?
No, not at all. I'm 29. I will be 30 this year.
Yay. And
fun.
we always say the younger you start, not too young, but you
Well,
want to
she
start.
brings up a very good point because, the current thinking is that you can actually train the muscles. Okay, so more and more younger people are coming in to have Botox because nobody wants to get older and get wrinkled. And, a lot of it has to do with your family. So if your parents wrinkled at an early age, chances are you will too. Now, of course, there's a difference between sun-induced wrinkles and aging wrinkles and smoking wrinkles. So if you smoke, if you go out in the sun, you're going to get these tiny, tiny lines. And of course, you're going to get skin cancer and other things like that. But natural aging is when you get things like furrows. Well, Stephanie just is, she's young and, she looks great. And she's just starting to get, like everybody gets, these little tiny furrows. People get these so-called 11s, which we see over here. And over time, they get more and more pronounced. And, we know because we see what our parents look like. And the key thing with Botox, as far as I'm concerned, you don't want to look like one of the Beverly Hills housewives.
Right, no, we don't
Okay,
want that.
to
You
me,
don't want your
that's
eyebrows looking like
yeah,
that.
you
They're
can't
like
you
this.
can't smile, you can't like do anything. I mean, to me, that's just like forget it. But believe it or not, we get patients coming in, and they want to look like Beverly Hills housewives.
I'm not that one.
No, I know, I can tell. But we try to discourage them. But hey, you're set, you're set. But no, someone with Stephanie, this is our first treatment. So we're going to just show everybody how Botox is done. And it's a very, very simple procedure. It's probably the simplest cosmetic procedure you can imagine.
It is important
So-
to have that conversation with your doctor ahead of time, though. Don't assume that what you're thinking is what the doctor is thinking, because again, you go with a more natural look. Someone might come in and they do want that more extreme look. So really talk with your doctor about it and make sure you're going to someone who is certified and knows how to do the Botox injection. You don't just stick a needle in your face and inject yourself.
Right. No, you can look very natural with Botox, which is, unless you put too much in, then you don't look as natural. The good thing about Botox, only lasts 4 months. Okay, so if you overdid it, it's going to wear off.
Right.
And the only real side effect you get with Botox is that sometimes you can get a little drooping of the eyelids. It just happens in like 1 every 200-300 patients. It's temporary. It just goes away. And it may last a day or two. It may last longer. But that's really it. Okay? And some people have headaches. And it actually, they don't come in for their headaches, but they state that Botox actually helps their headaches, and it's used as a migraine treatment as well.
So today we're
So,
going to do
yeah,
our
we're
line
gonna
on our
do-
top,
so,
and we're going to
Stephanie,
do
you
the
can
11s, right?
Sit
so
back. We're going to do the
Botox,
11. Here, you can sit back here.
Botox
And-
stock is used, just for people who don't know, is used for just the top of the head, right?
That is correct.
And then the
So-
fillers would be used around the mouth.
Right. I mean, you can use Botox around the mouth. I rarely use it. When people have these what they call gummy smiles, when you smile and you see your gums.
Yes.
Botox can help that, but that's the only time that I will use it. So, and a lot of times we'll do what's called the crow's feet, which are around here. Well, Stephanie doesn't have any, so we don't have to worry
Yet,
about
not
that.
yet.
Little 29. You'll never have them with Botox.
Well, unless you get stressed out, you know what
Yeah.
I mean? So you try not to stay stressed
So again,
out.
when people ask me about this and about Botox and fillers, I say to them, still drink a lot of water, keep yourself hydrated, always still eat good,
We had the,
stay out of
we
the
had the
sun.
whole water shop.
Yeah.
We had a
did
big
the whole-
fight over that, right? Because
but
you kept saying, drink water, drink
drink
water.
a lot of water. I still think
Enough.
you need to take care of your skin if it's
It's
dehydrated
not
and
going to hurt. It's not going to
you
hurt.
get Botox
So-
and then you smoke, your Botox
Well, yeah,
isn't
you
going to
don't like
last.
I forgot to ask, do you smoke?
I do not, no.
Okay, good.
I would
Good.
not have picked a patient that smoked
Well,
for
that's
my
good.
show
Okay.
with you.
Good one.
Okay, so what we're
Okay,
going
so
to
relax.
do, the first injection's here, and we go right into the muscle here.
Now there is some numbing
There. Whoop.
medication in there as well, correct?
No,
Oh,
no
really?
numbing. No
Did you,
numbing.
it's a small
And
needle.
then make a frown.
Make a frown?
Yeah, okay, perfect. Now you can relax. So we want to see where the muscle is. Right there. We go in here. And then we put a little bit in here. Do you take aspirin at all?
Advil?
Advil. Okay, that can make you bleed. Okay,
Yeah.
so, and I can see you're bleeding a little bit.
Okay.
So, okay, and we put a little
Now
bit
it depends on your skin type too. Some people have tough skin. Some people have more sensitive, thinner skin too, right, Doc?
Here. Yeah, absolutely. But if you take aspirin or Advil or whatever, yeah, that can make you bleed. So then we did this area. That's going to give her a little eye lift here. Okay, and it's going to help prevent these 11s. And then right up here, we're just going to go. We just go right, basically under the skin. And again, since this is our first time, we just do a small amount. And then we can always put more in. So I always tell patients, see how you did. And then if you think you need a little bit more in a certain area, we'll put a little more in. There. And that's really it. Okay, so you survived. I think you survived, right? You're still breathing.
So. I believe
All right,
so.
phew, man.
We'll wipe you off and go to break, and we come back. We'll get
you'll
some
do fine.
feedback.
Now
from,
again, we
Steph.
use in older people we put in sometimes twice as much. Okay, but this is her first time. I'll put a little bit more right over here. There. And the other thing I'd like to do too, I'd like to thank the manufacturer, Allergan, who actually supplied the Botox for you for free. So that was very nice of them. So
Very good. We're going to go to break. When we come back, we'll wrap up with Stephanie, answer some questions on Botox and fillers. SSP TV, ssptv.com. Welcome back. You're watching SSP TV and ssptv.com. We're here with Dr. Steve Schleicher and our guest, Stephanie, and we are educating you about Botox and fillers. And before the break, Stephanie had the procedure done.
exactly, and I'm pleased to state that Stephanie survived the procedure.
I'm alive.
She seems pretty healthy, so that's great. And what's going to happen in another 24 to 48 to 72 hours, she'll feel that little tightness up here. And what Botox does, it really relaxes the muscles, okay? Actually, there's nerves that go into the muscles, and there's a little transmitter, a chemical transmitter that goes from the nerve to the muscle. So what Botox does, it blocks that transmitter. And when it does that, the muscle just automatically relaxes, and then the lines disappear. So that's how it works.
How was the procedure for you?
It wasn't bad at all. I mean, I definitely felt the needles, but it wasn't uncomfortable or too painful. It was fine. I survived.
Yeah, and one of the cool things is that they're working on a topical Botox. How well it's going to work, I don't know, but they say if it's going to work anywhere for the crow's feet, for right around here, by topical means you won't need it injected. So there's studies now, I mean, I find it hard to believe, but they've done some incredible things, and if it works, people who are, we call them needle phobic, they don't like needles, and some people are just afraid, even though you saw, I mean, it's the tiniest needle, you can hardly even see it, but some people just don't like needles. So for them, it's going to be ideal. No idea when it'll be approved, but it's something to look forward to, and it is very, very exciting.
So you're seeing more and more patients. It is gaining popularity as far as getting the Botox over getting a facelift.
Well, yeah, I mean, facelifts are very expensive, and Botox is so easy to do, and it gives you a natural appearance. Now, there's other things that can be done too. You can do fillers, okay? For instance, people tend to get creases here. They basically, your skin just tends to kind of collapse as you get older. So we use fillers to give it more support. So let's say if you had really deep creases here, you wouldn't use Botox for that. You would use a filler. Fillers called Juvederm or Radius or Restylane. Okay, there's lots of them out there. They work great. They're very, very easy to do. And they're simple, and people can't tell. You go in, it's not facelift, you're out of commission for quite some time.
So
Okay.
the younger you are starting, when should you really start with the Botox and the fillers?
Well, you know what? A lot of it depends on you, okay? I mean, how comfortable you are with you. Some of it depends on how your parents aged, okay? And if they looked older at younger years and you don't want to look like them, then definitely you start, younger. But your age is, perfectly fine, because that's when people start noticing these little wrinkles and whatever, and frown lines and whatever. And the ultimate goal is to train your muscles. So hopefully over time you use even less Botox because your muscles are trained. And then, 3-4 years from now, they're kind of trained, and you just use either the same amount or even smaller amount, which would be great. Which would be great. Just don't take up smoking.
I was
will
gonna.
not.
That was my
I don't
next
have any
point for
plans to.
people who are investing in the Botox and the fillers, and then they're smoking. How long does the Botox and fillers
Well,
last
the
for those
Botox
patients?
isn't really affected by the smoking, but the fillers are. Because the fillers, basically what cigarette smoke does, it helps dissolve the tissue that holds up your skin. So if you put in, say, it's really natural fillers, but if you put these fillers in, the cigarette smoke is going to help break them down faster. So what's the expense? You're spending money on fillers, which aren't the cheapest things in the world, but you're smoking and you're dissolving them from the inside. So that's a good reason to definitely stop smoking if you're concerned about aging. Okay, let alone lung cancer and heart disease and whatever. Some people, it's home when you talk about wrinkles. Okay, and you've all seen cigarette smoker, the creases they get,
Right.
and they're very tough to get out, extremely tough to get out. So
Okay.
that's the thing we want to prevent.
All right. Any questions from you, Steph?
No.
She's just
I
happy
think
camper.
I am happy.
Yeah, you did great. You're a great model. And when it wears off in 10 years, you come back in.
There you go.
Right?
Perfect.
That's all.
Okay, so Botox is safe. I know there's been studies done, and over the years they've had a lot of advances in it.
Like I say, it's the #1 cosmetic procedure. So there are days when I'll do 4, sometimes even 5, injections. That's how common it is. And it's really a lunchtime type of procedure. People come in during their break or whatever, and they get their Botox and they go, and no one can tell.
So as far as like washing my face or makeup tomorrow,
Normal. Tomorrow, just normal. Yep,
Okay.
yep. You can do normal. And then you'll feel the little tightness over the next 24 to 7.
I actually feel nothing now. I mean, I
No,
don't know. It
no,
doesn't
no,
feel
no,
any
you did
different
great.
than what it did
Yeah,
before.
you did great. You did great. And you'll do great. So,
Good.
yeah.
Well, thanks
Yeah,
for coming
perfect.
on
Anytime.
this program.
Thanks for
And
having
thanks
me.
to my son. He skipped out of here. He has things to do, places to be.
He's a busy boy.
We're not important enough for him. So that's the way it is.
And Doc, thank you. If you have any questions, you can always contact us through social media or through ssptv.com. If you want a procedure that you want to see here in the office, I know that we get a great response from our audience here at SSP TV. So thanks for joining us, and we'll see you next time here on Skin Sense.